You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe, but we're celebrating our 10th anniversary of the Health Matters radio program. We're planning some special shows to celebrate the milestones, so we hope you'll stay tuned. Let's begin today by thanking our sponsors, Studio Arts and Glass, Cleveland Clinic Mercy Hospital, and of course our socially distant producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our very special guest, Kristen Lane, Communications Manager, Vitalant. Good morning and welcome to the show, Kristen.
Good morning. Thanks so much, Paul.
Many people believe that the most blood is needed after major disasters. However, daily personal emergencies and ongoing medical needs of thousands of patients require a constant and ready blood supply. It's the blood already on the hospital shelves that saves lives. Today, there is a critical need for blood donations, and we would like to dedicate our show to sharing information about blood donations. Every day in the U.S., patients in hospitals, surgery centers, and emergency treatment facilities need approximately 36,000 units of red blood cells, 7,000 units of platelets, and 10,000 units of plasma. When you donate blood, you're part of something bigger than yourself. It is a simple act of the ultimate pay-it-forward moment. Please enjoy our show today as we talk with Kristen about the process of donating blood, the safety precautions in place during the pandemic, and the positive impact donating blood has on people's lives. We'd like to remind everyone listening this morning that this program is available on our podcast. Please search for Health Matters with the Medicine Center Pharmacy in your favorite podcast app and subscribe, and you can listen anytime.
So, Kristen, welcome to the show again. Introduce yourself, tell us about yourself, along with explaining your role.
Well, thank you so much for having me on. This is a really important message to get out to our community. I am the communications manager at Vitalant, and my job is to tell the story of the need for blood. And, you know, that's not a story that's on top of people's minds all the time. One of the comments I heard quite frequently at the beginning of the pandemic was, well, why do you need blood right now? People who have COVID-19 don't need blood transfusions. And that's absolutely correct. However, there are daily needs for blood by people who are being treated for cancer, by people who unfortunately experience traumatic situations like car accidents, manufacturing accidents, other trauma. New moms. Moms can hemorrhage during childbirth, and babies can be born with the immediate need for blood. And then there's elective surgeries. There are some elective surgeries where we need to keep blood on hand should that patient need it. So this is just, these are some of the examples where people need blood at all times. Vitalant is the new brand for LifeShare. And LifeShare has been around for many, many years in our community. We are the same nonprofit blood donation. We just have a new brand. And we joined forces with a nationwide network of other blood donation centers. And one of the goals of our network is to use the blood that we collect at all of our locations to share it where it's most needed. Now, one of the examples of that, actually, it's very sad. This past week, we've had, at last count, 3 mass shootings. This is unfortunately becoming more and more common these days. And when there are survivors of these shootings, that certainly is a trauma. And in many cases, these survivors do need blood. So I'll use the mass shooting in Las Vegas a few years ago as an example. We were able to triage our blood supplies from other areas of the country to get them to those victims in Las Vegas. Now, blood is not only needed in the very sad cases of mass shootings and terrorist events like that. There are natural disasters. The recent flooding we have, again, people say, well, you know, flood victims don't need blood. That's correct. In most cases, they don't. But if flooding cuts off roads, if flooding makes transportation impossible, if there are electrical outages and other utility outages due to flooding, the blood can't get to the hospitals. So it's the blood that's already at the hospital and that what we can provide that helps the patients who are already in the hospital.
When we think of people with who need blood, emergency situations like car accidents and mass shootings, like we were talking about here, are there circumstances that we need blood?
Well, one of the most common is oncology patients. People who are being treated for cancer are also often getting chemotherapy treatments. Now, the chemotherapy drugs are miraculous in that they kill off the cancer cells. However, in many cases,
Oh,
they
that's
also kill off the platelets.
mm.
So, chemotherapy patients very often need platelets. I'm getting a little ahead of myself here, but I'll share right now that platelets are one of the components in our blood. Uh, I'm going to give you a pop quiz. Do you know what the three components that blood comprises are? You already have one, it's platelets.
Plasma, is that the other one?
That's the other one, and there's one
Okay.
more. That's the most common.
Water.
Red blood cells.
That's right,
Okay,
Brad. It's
okay.
red blood cells. So blood does have three
Huh.
components. And so when someone donates whole blood, and whole blood is the term that we use for the blood, it comes right out of your vein. We put it right in that blood bag and we uh, process it, send it out to be tested to make sure there's no bloodborne pathogens or anything else going on. So it's nice and safe for the recipient. But we also can separate out those components in the blood and give them to different patients who need the specific components. So, for example, cancer patients most often need platelets. Uh, People with chronic diseases, uh, burn victims, and shock and trauma patients often need plasma. And babies who are born prematurely often need red blood cells themselves. So they're just three examples of patients who need particular components. So it's really interesting about that. When you are a whole blood donor, which is the most common type of blood donation, you're saving three patients' lives with one
Mm.
blood donation.
Now, platelets, I assume that the chemo drugs destroy the platelets or minimize them. Is that correct?
That is correct. They're reduced.
And that's why else would I need platelets other than cancer?
Well, platelets are the clotting component
Sure.
of your blood. So if you have a clotting disorder like hemophilia,
Yeah,
uh,
okay.
hemorrhage, that might be uh, an example of when you might need platelets. I do want to
Hmm.
be very upfront, very candid. I am not a medical professional. I'm a communications person, so I don't want to get too in depth in the
Well,
medical community.
the reason I asked you about the platelets is I have a very good friend who right now requires a lot of platelets, and I haven't seen her in a while, so I really wasn't aware she was ill. Um, but her platelet, what would be a platelet count? Do you know?
It
Um,
depends on the patient, but if you get a very low platelet count, that's when you really need platelets. Clearly, uh, the big issue with platelets is they have an extremely short shelf life. They're only viable for 5 days.
oh, wow.
So that's why platelet donors are always in need.
Hmm.
And I'll explain that a platelet donation is very different from a whole blood donation. And the big difference is we use a machine, it's an automated process. And to a non-medical professional like me, the process of automation and blood collection, which is called apheresis, another big word hard to pronounce, to me it's miraculous. So my layperson's description of what happens during apheresis or automated blood collection is, first of all, we determine what component of that blood is being collected. So Paul, you mentioned platelets. I'll come in to donate platelets. sit down in a comfy chair. And I should mention in our donation centers, we really focus on comfort. We have nice lounge chairs, TVs, bring you a blanket, make sure you're have hydration, refreshments, really take care of you.
Do I still get orange juice after I give
You get
blood?
orange juice actually you're next to a machine that has a little centrifuge built into it. Our donor care team, our phlebotomists, put that needle in your arm. It's actually two needles. One is to take the blood out. And here's the
Mm,
amazing part. One is to put the blood back in. So during this process, your whole blood, remember that's the blood that has three components, platelets, plasma, and red blood cells. Your whole blood is removed from your body. Now, here's where the amazing part comes in. You're sitting right next to this machine. This machine has a centrifuge that spins out the platelets from
mm,
that blood,
wow.
puts it into a bag. You see that bag hanging right next to you. You can see your platelets. They're bright gold. We call it liquid gold. And
Mm,
then the miraculous part is the remaining components are put back into your body with that second needle.
mm.
So the platelets are spun out. You get your plasma back. You get your red blood cells back. And we give you a little bit of a hydrating fluid as well, just to make sure you're well hydrated. That whole process takes about 2 hours. It's a long process.
Hmm.
It's a very special type of donor who does make a platelet donation because you do have to give up 2 hours of your day, sometimes longer, because you're also including your travel time. But we really pamper our platelet donors. They are very, very special. They are saving so many lives. And you just mentioned your friend who needs platelets. Uh, One of the amazing parts about donating blood is the feeling you get because you are saving lives. I mean, that is just an indescribable feeling. If you're a doctor or a first responder, that's your job to save lives. I'm just a regular old person, no first responder training, no medical training. But when I donate blood, I come out of that donation floating on a cloud because I think I just helped somebody. I will probably never meet that person. But what's interesting is when you are a blood donor and you're talking to people and they find out you're a blood donor, or in my case, that I work with a blood donation organization, they say, oh, fill in the blank. My dad needed blood. My son needed blood. My a best friend needed blood. And then I think, oh, maybe some of me is in them.
Hmm.
It's just an amazing feeling.
Interesting. Okay, you got that person in the chair. Why don't you just keep all that blood?
Well, we like to let our donors survive. we they need that blood, so we'll just take a pint, and let them keep the rest.
No, that's a serious question though. You're drawing all their blood out, okay, right? And
Oh,
taking
not
the
no,
and taking the platelets out. No?
not all of the blood. We just take about we call a pint a unit. Because
Yeah,
sometimes
okay.
if you have a high platelet count, this is getting kind of the medical technical part. If you have a very high platelet count, you can donate what we would call a double unit or a double donation. But we do put everything else back.
Okay. Okay, it's time for our first break, Kristen. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing blood donation with Kristen Lane.
All right, Kristen, you mentioned at the break we were chatting, and not enough people are donating blood to provide hospitals with the blood they need. Why is that right now?
Well, Brad, the biggest issue right now is the pandemic after effects. So we have two types of blood donation opportunities. The first one, as I described before, our donation centers. They are the brick and mortar locations that have regular hours, evening hours, and people know where they are, they can visit. However, the other really important aspect of blood donation is our blood drives, our community and closed blood drives. And I'll explain the difference in a moment. Uh, Businesses, churches, synagogues, schools, civic organizations, they all generously host blood drives. And these blood drives could either be for the whole community, meaning anybody is invited to attend that blood drive, or they're exclusively for the employees, members, students. We call that a closed blood drive. Well, during the pandemic, businesses, churches, schools, synagogues that used to hold those blood drives
Yeah.
often were under shutdown orders, and they no longer could host these drives. So we lost hundreds and hundreds and hundreds of blood drives. And from those blood drives, we lost thousands and thousands of anticipated units of blood. Really interesting. One of our largest groups that donate blood are high schools and colleges. And I'm full of pop quizzes today, so I have a pop quiz. Do you know the number one reason why high school kids donate blood?
Money.
Did you say
I said
money?
money. Yeah,
No,
cash.
no, we don't pay for blood. No.
Well, I'm thinking about this plasma place in the university where my daughter went to school. Okay,
Sure.
right on the corner of the main street. Hey, we pay something. So.
Yeah, that's interesting. I want to go back to that in a moment, Paul, but you're not getting off the hook for this pub quiz.
Okay.
Money is not the number one reason kids donate.
Interesting.
The answer is they want to get out of class.
Oh, geez, come on. Class isn't that painful.
Well, we don't know that.
I don't know, whatever. Oh my gosh, isn't that crazy?
So, but what's interesting is, we bring our, I call them a pop-up blood drive. Yeah, we bring everything to the location. We bring the donor cots, the donor beds,
Okay.
our staff, all of our equipment, our cookies and juice. And these blood drives disappeared virtually during the pandemic.
Wow.
So we are really scrambling to make up for all of that lost time. And certainly we're not alone. So many organizations just really suffered last year during the pandemic, and we're just beginning to come out of it. So that, to answer your question, Brad, is one of the big reasons that people were not able to donate. Another one of the big reasons is there are a lot of factors that make someone eligible to donate blood. And if you're not eligible to donate blood, obviously that takes you out of the donor pool.
What are some of the reasons that people might be deferred from donating?
Where do I start? I'm going to start with a statistic. At any one time, only about 40 to 45% of the United States population is eligible to donate. And that's kind of a fluctuating eligibility. And here's why. Depending on where you've traveled, depending on what prescribed medications you're taking, I know that's a subject near and dear to both of your hearts, depending on whether you have had a tattoo or permanent makeup or microblading, that's the new eyebrow tattoo, you may be deferred for about 3 months for donating. And plus, people have been sick. They're all reasons.
Well, with the a tattoo, why would that be? I mean, I can see why you wouldn't want to put a needle through it, but
Great question. So there are some states, not including Ohio, that do not regulate their tattoo facilities.
I see.
If you have received a tattoo in an unregulated state, like Pennsylvania, for example, we ask you to wait for 3 months. If you have your tattoo or your microblading in Ohio, you're good to go. But they're just examples around the country that could defer someone.
Okay. All right. Bottom of the hour time for the news. You're listening to Health Matters with the Medicine Center Pharmacy. This morning, we're talking about the importance and the ease of blood donation. We have a lot more to cover this morning, so let's get back to the show.
All right. I understand that Vitalant is testing all blood donations for COVID-19 antibodies. Can you tell us about that?
Sure, Brad. We have been testing all blood donations for the antibodies since last summer. And what we do with the plasma of people who have tested positive is give that to people who are suffering from a severe case of COVID-19. And when I say a severe case, I mean in the hospital with a ventilator. So if you think
Hmm.
about it, if you've had COVID-19, your body has developed antibodies to it. Those who have tested positive are able to help those who are suffering because their plasma has so many antibodies in it that it gives the COVID patients kind of a boost. It's a weapon in helping them fight the disease. So for a while, we were having strict plasma, COVID plasma, we called it, donations. Now that we're getting the vaccine out and the cases are starting to dwindle, we are able to just take the plasma from the whole blood and transfuse it into COVID patients. So you don't have to make a special donation. You can just donate whole blood and your plasma will still help COVID patients. The other
Hmm.
interesting part about this is so many people have had COVID, had no idea they had it because they were
Hmm.
asymptomatic. And I cannot tell you how many blood donors have commented to us that they were shocked to get their results because they had no symptoms. And a lot of people were so, grateful for their personal good luck in not having symptoms. They really do want to donate in an effort to give back.
Hmm.
Well, that's part of our COVID screening process. We're very, very careful about our donors. We make sure that they are feeling well the day of their donation. If they have COVID, we make sure that they have been symptom free and cleared for at least 6 weeks after their infection with the disease. We also have a lot of social distancing uh, efforts in place, just like everyone else. We make sure we take everyone's temperature before they come in to donate. We have constant sanitation. I said to anyone in our blood donation centers or at our blood drives, don't stand still for more than 3 seconds because you'll be sanitized. We're just constantly cleaning everything. We have 6 foot distance, so we are taking every precaution to keep our donors safe, to keep our staff safe, to keep other donors and ultimately the recipients safe.
Wow. Are you in need of certain types of blood right now?
Yes, we're in need of every type of blood at all times. We have a special need right now for people who have O type blood, either O negative or O positive. But I never want to discourage other blood types, people with other blood types to donate. And the reason for that, Paul, is because we need a constant supply of blood at our hospitals at all times to be ready. Uh, I you probably can't wait till we're done with our conversation because I have so many pop quizzes for you. But I have another. What happened on September 9th, 2001?
9/11, September 9th.
Yeah. And,
September 9th,
oh,
I don't know.
2001.
9/11. Let's see.
Well, you're
September.
you're both on the right track.
Yeah.
The people who donated blood on September 9th, 2001 were the donors who helped the 6,000 victims
Mm,
of 9/11, the people who lived
I
and
see.
needed blood. Why, you ask?
Hmm.
Because it's the blood that's already on the shelves at the hospital that
Oh.
helps people when they're rushed in.
Hmm.
And that's because it takes about 48 hours to test that blood to make sure it's safe for being transfused into people, and
Okay.
also to manufacture it. And what we mean by that term manufacturing is separating out those components that we talked about. So when there is a a national disaster.
Mm.
We experienced it in nearby Pittsburgh 2 years ago with the Tree of Life synagogue shooting. People lined up down the block to donate blood.
Mm.
But even though they were generous, wonderful blood donors, their blood wasn't helping the people
Mm.
who were affected in that shooting, the people who were
Amazing.
injured.
Mm.
So I always have to be very, very careful the way I say this. We never want to discourage anyone from donating or make them feel like their blood is not needed. But
Mm.
it's the regular donors who donate on a schedule as often as they can that do help the people in emergencies.
Mm.
And another way I look at blood donation is kind of like going to church, going to synagogue, going to the gym. It's not just a one and done. You don't
Mm.
just get on that treadmill once a year and say, okay, I'm fit. You have to keep doing it. Same thing with your faith, however you practice your faith. It's not a one and done. It's the same with blood donation.
Well, I just think I almost think it would be fair to say that your people standing in line in Pittsburgh did help the people during the crisis because they replaced all the blood
Yeah.
that may have gotten redistributed from other hospitals. So you're still, I mean, I understand it's all in framing, but it's unfortunate, I think, what you're trying to say, that a crisis event makes people more aware of the need than the need on a daily basis. So
That's exactly right, Brad. And you're highlighting what I'm saying. We never want to make people feel like their blood is not being needed. It is needed. And you hit on a really good point. One of the types of blood drives we at Vitalant host on a regular basis are called replenishment blood drives. And if there is a patient who is receiving a lot of blood donations or platelet donations, or I'm sorry, transfusions or plasma transfusions, the family and friends of that patient often host a blood drive, and we call it replenishment. So
Mm.
just like you said, Brad, those donors are replenishing the blood, plasma, and platelets that have been used by that patient and giving it back to hospitals so it's available in the community blood supply. So you
Mm.
raise an excellent point.
It's interesting. Wow. Um, is it safe to donate blood during the pandemic?
Very safe. Uh, both FEMA and the Surgeon General have designated blood donation as an essential function. As I mentioned before, we take every kind of precaution to make it a safe, comfortable, and excellent practice. And we encourage people to come. We were open throughout the pandemic. We never shut down because the need for blood never shut down.
So all the blood is cleansed the same way, all the blood donations. Is that correct?
It is. We test the blood for multiple bloodborne pathogens, so it is very safe. If you think about it, people who are receiving blood are already in a compromised state of health, so uh, we have to make sure that the blood they receive is 100% safe, and that's why we go through the screening process.
what should someone do to prepare to give blood?
Great question. First thing, two most important things: eat, and drink. Lots of water. Hydrate yourself. When you properly hydrate, you actually can plump up your veins, and it's much easier for the phlebotomist to, get that little needle jab in. Make sure you have a nice full tummy before you go in. You never want to donate on an empty stomach. I also,
Mm.
this is my personal view. I personally believe that calories don't count on the day you donate blood. So you can treat yourself to something delicious afterwards, just as a congratulations for saving lives.
How often can people donate?
Well, it depends on what you're donating. You can donate whole blood every 56 days. You can donate platelets much more frequently, every week or every 2 weeks, and plasma is a little bit longer. That also depends on you personally, your blood volume. We all have different blood volumes. So our phlebotomist makes sure that it's safe for you to donate, whatever your donation preference is.
Run the platelets number again. How often platelets?
You can donate platelets every week, every 7 days.
Gee,
You can do that up to 24 times a year.
wow. Okay, our final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Did we get this one about the shelf life of blood?
Platelets have the shortest shelf life. That's 5 days.
Wow.
Plasma we can freeze plasma. That can last up to a year. And red blood cells can last for about 42 days.
Okay.
All refrigerated. Certain temperature?
Yes, correct. Well,
Okay.
no, not the same temperature. The plasma's frozen.
Okay, gotcha. Okay, so tell us about the process for donating blood and what a donor can expect.
We make it super easy for our cherished donors to donate. When you come in, we welcome you. And the first thing we do now during COVID is take your temperature to make sure you're in that healthy range. The next thing our donors get is a mini physical. We're very lucky to have physicians on our staff as our medical directors. And these physicians have multiple specialties in hematology and other specialties. So they know the range of temperatures that are best suited for donating blood.
Okay, I'm sorry, I didn't mean to interrupt you.
Oh, that's perfectly fine.
Go ahead.
So let's go back into that mini physical. After you get your temperature taken and you're within that healthy range, then you come in for your medical questionnaire. We ask everybody to fill out a brief health history that answers questions about some of those reasons you can be deferred. For example, have you traveled within the past year to a location that is a malarial zone? Pretty much everyone says no this year because no one's been traveling. Uh, but we talk about other behavioral factors. And then once that questionnaire is over, you get your mini physical. So we get a hemoglobin test. You get a little finger stick. Just draw a tiny little drop of blood to make sure your hemoglobin, your iron, is sufficient for donating. We do a cholesterol test. We take your pulse and blood pressure. And donors can find all of that information in their personal donor portal. It's online, it's 100% secure and confidential. That's also where we have your COVID antibody test results there. Once you get through your mini physical and your questionnaire and everything's good to go, we set you up in our comfortable donor cot or donor bed, however you want to refer to it. And our professional phlebotomists clean your arm very carefully to be sanitized. Get that little needle jab. That needle, if you're donating whole blood, is really only in your arm for about 10 to 12 minutes. It's not long at all. We take that out, we have your blood, and then it's Paul's favorite part of donation, juice and cookies. And the reason,
I forgot the cookies. Yeah.
don't forget cookies, they're very
Yeah,
important.
okay. All right.
Grandma's chocolate chip.
What kind of cookies? Yeah.
Grandma chocolate chips, they're the
Ooh,
best.
Grandma. Okay.
Absolutely. And the reason we do that, we want to make sure our donors are feeling good. We ask them to hang out for about 15 minutes just to make sure they're not feeling lightheaded or any side effects. And then you're on your way and you leave with that feeling that you have saved lives and you have given someone another birthday.
Interesting. So should we make an appointment or can we just walk in?
You can just walk in. We prefer appointments for your convenience. Appointments also help us with our social distancing. We make sure that we are within our capacity ranges, depending on the size of the blood drive or the donation center. And it's really, really easy to make an appointment. You just go to our website, which is vitalant.org. Make your appointment. Or if you are a phone person, you can give us a call at 877-25-VITAL. And those numbers are 877-258-4825. get you all set up. We have 3 donation centers in Ohio, one in Canton, one in Elyria, one in Middleburg Heights, and we would love to welcome you. It's on West Tuscarawas,
Okay.
4119. Yes.
Now, what kind of hours do they maintain?
We have different hours every day. We have evening hours, we have early morning hours. Again, these hours were developed to help people who had that regular work schedule. Now that so many are
Sure.
working from home, uh, we have kept up those hours because people, of course, still have daycare and school restrictions. But we try to make it as convenient for our donors as possible. Just pop on our website, vitalant.org. You'll see the hours not only for our
Mhm.
3 donation centers, but all of the community blood drives that we're hosting
Mm.
throughout the
I
area.
guess we're out of time, right, Brett?
Yeah, we're out of time, but I'm
Thank you
glad you
very
shared your
much.
message.
Thank you very much, Kristen. We really enjoyed
Yeah,
it. Okay. Very
thank
interesting
you.
program.
Take care.
Communication manager for Vitalant. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Cleveland Clinic Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. As always, thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Thanks very much.